Hi, I'm Stephanee Evers, and I'm an emergency physician at Olathe Medical Center. I'm here today to answer some questions and concerns that people may have about coming to the emergency department during the coronavirus pandemic. One of the most frequently asked questions we get is it safe to come to the emergency department at this time? The answer to this is yes. At Olathe, we have protocols and processes in place to make sure that we keep our patients and our staff safe during this difficult time. When a patient comes to the emergency department, we ask them a series of questions regarding potential COVID-19 exposure or symptoms that they may be having. In order to minimize the number of patients and time spent in the waiting room, we take patients back to their individual private exam rooms as soon as we can. The rest of the triage, registration, and assessment occurs in that individual room. By doing these questions early on in the process, we're able to separate patients who may potentially have COVID-19 from those who don't, and that helps keep our patients safe. In addition, when patients leave the emergency department, all of the rooms are decontaminated and disinfected thoroughly before the next patient can be brought back. The next question is, will I get COVID-19 if I'm treated in the ER? The answer to this is probably not. In addition to the processes that I just described, we take some additional measures to make sure that we keep our patients safe. All of our staff, including registration, patient care techs, nurses, advanced practitioners, and physicians all wear personal protective equipment or PPE. By wearing this PPE appropriately, we're able to mitigate the risk of contamination to ourselves or cross-contamination to our patients. We also encourage patients to wear their homemade masks in their rooms for more comfort and another level of caution. The last question is, do I need to quarantine if I was treated in the emergency department? The answer to this question is no. The CDC, KDHE, and Johnson County Health Department do not indicate that being in the emergency department poses any additional increased risk for transmission or exposure to COVID-19. You're just as safe being in the emergency department as you probably are going to the grocery store or any other essential business. That said, if you are in the emergency department with COVID-19 symptoms, you will have to follow specific self-isolation guidelines for the disease itself. We know that COVID-19 can be scary, but we also know that emergencies and injuries are going to continue to occur during this time. And we don't want patients to be scared to come to the emergency department when they need to. We don't want people ignoring symptoms of heart attacks and strokes because they're afraid they're going to get the coronavirus if they come to the ED. We want you to be safe and healthy, but we want you to know that we're here for you too. Our emergency department at Olathe Medical Center is fully staffed 24 hours a day, 7 days a week, and we're here for you. Have a great day and be safe.